For gastrointestinal diseases, we have Hirschsprung's disease, cleft lip or palate, dehydration, diarrhea, constipation, gastroenteritis, gastroesophageal reflux or the GER, hypertrophic pyloric stenosis, and intussusception. For cleft lip and palate, it's a structural disorder of the mouth and pharynx, and sometimes it's genetic or hereditary, and it's a visual separation of the upper lip. It will affect speech. So if she were to ask a question like, oh, what are things that can affect the child's speech? Cleft lip, palate, and what were we talking about earlier? Hearing loss. You would need to repair it. So the repair is performed between 2 to 3 months. You need special nipples prior to surgery, and it may take 1 or more surgeries to fix it. For nursing care, feed them sitting up, burp them often, and said take patience. For GER, it's pediatric gastroesophageal reflux. So gastric contents reflux back up into the esophagus, making mucosa vulnerable to injury from the acid. It's self-limiting, so it heals itself by 1 year, and it can recur in childhood or adolescence as a cough. And make sure that the GER is not pyloric stenosis. Treatment. Oh, I don't remember if I... Anyways, it can be caused by a lack of enzyme to break down milk-based formula, and the mom's breast milk can be affected by extra acid if she eats or drinks certain foods. Continuing GER, baby usually does well if they're elevated during feeding or sleeping, and a gastroenterologist is not needed most of the time, but if it remains, check for Helicobacter pylori. It will need special treatment. It's also treated with famotidine and pantoprazole to help with the stomach acid, and also make sure that there's no hiatal hernia. Moving on to acute gastroenteritis, there are multiple types. There's rotavirus, but rotavirus has immunizations available. Enterocolitis, E. coli, Salmonella, Shigella, and I think C. diff, if I'm not mistaken. So acute gastroenteritis can be mild to severe. It is the stomach and intestine both with inflammation and infection. It's like both of them at the same time. It's normally from community-acquired viruses, especially popular in daycares, schools, and in close contact situations. So it's like very contagious. The biggest problem we'll have is dehydration. Sometimes you need the hospital. The signs and symptoms are nausea, vomiting, and diarrhea, low-grade fever, and stomach pain. But the severe signs and symptoms are bloody diarrhea, dehydration, electrolyte imbalances, and ABG abnormalities. You'll need IV fluids with hypertonic 0.45 to 0.9 sodium chloride, or dextrose 5 for cellular energy. For meds, you need ondansetron or Zofran or Reglan metoclopramide for stomach cramping. To treat and the care at home, small sips of room temperature fluid frequently, and a bland diet. So the diet in the slide was the brat diet: bananas, rice, applesauce, and toast. Watch out for neurological changes. Watch for weight loss, and only 3 to 5% of the weight to be lost. Only 3 to 5% of weight to be lost daily during acute illness with slow rebuild. It is mostly fluid loss.